We're gonna swing. I'm fighting down. Yeah.
Yeah, this computer's boot.
Well, it's because I tried to delete all the user
I'm
profiles.
saying it's not. The test really isn't that hard.
And she
How
got
do some of
16
y'all take
open.
the test? Y'all take it and just fly through it? You shouldn't do that. Take it, just read the question. How many of y'all read the question, try to think, and then you read it again?
I like sometimes come back to it.
Yeah, I'm like, okay, I don't know
I
what
feel
else
like
that.
maybe
So
another question.
Don't change your first answer though.
Yeah, don't change the first answer. That's why
I made that mistake all the damn
This is what
time.
I do. I read the question, and if I don't know what the fuck they talking about, I skip it. Cause I'm not about to put myself down like that. I'm like, hey man, I don't know what the fuck I was doing. Read it, don't know what
I
it's
would
talking
go
about,
through the exam
on to the next
twice.
one.
Like,
Yeah,
go
me too.
through,
There you go.
and then I go back.
Yeah.
Is everything still
I'm
loading?
saying everybody got different ways of taking the test. All I'm saying is when you're in there, y'all need to be calm. Don't go in there stressing out. Don't go in there
I don't even see the hourglass
overthinking
loading.
or anything like that. And that's coming from somebody that took 13 times, that was overthinking, that was changing his answers.
Just click on
Anything
recent
that I
files.
could have done to fuck myself over, I did it. I did it on the test. You know what I mean? I literally, all I needed to do was score. And if I tell y'all this, y'all can be like, this is a fucking idiot. I'll tell you like this. I needed nothing other than the test score. Everything I was maxed out at. Maxed out on award points. I got 15 fucking points for awards and I can only use 12 of them.
Alright,
Year, time and service, got all that.
so we run a little behind, so we gonna push through.
Alright, operative. Alright, no. Dental specialties.
Nah, we don't need those.
Instruments.
This is chapter 16, operative dentistry. Well, shit. They don't need to know the instruments. So the zones, this is what you're gonna get on.
Yeah.
I'm telling y'all, this chapter right alone, we're almost there, Chief. We got two more.
Not a problem.
All right. So
It's just the zones. Yeah, I think it's the zones.
the aspirin syringe has been on there, but that's just, we know what that is. It's to give anesthetic. Hold on.
Aspiration.
Rubber dam. I don't think they've asked about the wings before.
They don't ask about the wings, don't ask about the
They asked about the retainer before. So your matrix retainer is what holds. It's a metal band that forms around the tooth when you're doing a filling.
right there. Kind of like that. That little matrix band piece.
It does not. Trust me. Four-handed dentistry, the zones. Okay, so make it self-explanatory for y'all.
So now we kind of explain it real quick so that way y'all can see.
No, I want you to keep in mind too. There's two zones that will always stay the exact same, and that's going to be your static zone and your transfer zone. Those will always be that. They will not change. These other two are going to be changing on what type of dentist you have, if they are left-handed or right-handed.
Alright, so you see the zones and stuff like that?
This one, I wouldn't.
So I don't like this because it's from the top. So just everybody stand up real quick, come up here so that way y'all can hurry up and get it. So that way we can move on. Everybody get up. Come on. Hurry up. Alright. So I'm the patient. Come on, walk a little faster. Conahan, you the doctor. Stand behind me. Stand behind me like you treat me. And then H1 is the assistant. So H1 is, so think of the static zone, right? Static meaning what? Just like on TV. There's nothing there.
So,
static zone.
If
Down
she's
this
12
way.
o'clock too, right? So we're going to look at her as 12 o'clock. Okay? 12, 1, all the way back around. Okay? So if I'm standing in the assistant zone right now, I am technically over here, which means that this is going to be a left-handed dentist for this one, right?
Mhm.
So my assistant zone right now would be the 8 to 11 for a left-handed dentist, right? Now if it's a right-handed dentist, I'll be over here in the assistant zone between 2 and 4.
Does that make sense?
Okay? That's the only thing that changes. Now, static. What does the term static mean?
There's nothing happening.
Nothing
Exactly.
moving, nothing happening.
So nothing's
The zone
right
that
here.
nothing happens is your 4 to 8 right here where the patient's feet are.
Right.
Right? That is always going to stay your static zone. Your transfer zone, you're 11 to 2. So she's 12 o'clock. So from here to here. So that's where we have the tray with all the instruments sitting behind them. And then we are then handing them the dentist before in dentistry. We'll have one instrument in our hand, one instrument in our pinky. We're handing it to the dentist while he's handing us something back
Not over the
and
face.
moving it back, right?
Yeah.
Wait, she's
It's almost like poetry
I'm
in
the
motion
dentist,
when you see it.
So,
But that is the only two zones that don't change,
Mhm.
and just basically based off of the handed dentist
Mhm.
is going to matter on your assistant zone and operator zone.
so I work with this hand, so that's why he's on my left. So when I grab my instrument, he does it with a pinky. There's like a certain way to,
Fulcrum.
way
Fulcrum,
to come
yeah.
out. Yeah.
That's it.
Well, fulcrum can also be your
Yep.
ring
Yeah.
finger.
To
Ring
anchor.
finger,
Yep,
whatever
to
it is.
anchor.
So think about it. If a dentist is like
There you go.
this, he's going to be using his right hand to do the drill. So your right-handed dentist
Don't think
right
like that.
here. So your operator zone
Don't
is
think
8
like
to
that.
11.
Sit down.
Which hand are we
No,
using?
sit down real quick. Hurry up. Cause Chief gotta teach. Sit down.
ain't
Sit
taking
down.
long.
Sit down. Look up. No, like put your feet up. Scoot down. Now look up. Now that is how you're gonna do it on the test. Does it make
Okay.
sense? Don't look forward because you're not gonna get it. You look up. Where's the dentist at? 12 o'clock. Straight up. So put your
Okay.
hand straight up. That's what. Yep.
Well,
Static zone is
technically, the
where?
dental
Where's the
dentist
static
is
zone?
right here.
Down here.
Your
Exactly.
dentist
You
is
get
going
what
to
I'm
be
saying?
8 to 11.
That's how you need to look at it. Don't look at it like you're looking directly at the clock because you're gonna be thrown off. All right? Does it make sense, Sean? What you
I
got?
was gonna say that on the test they would also ask like where did they put the patient? It's gonna always be below the elbows.
There you go.
Does that help make sense to y'all? The only thing that's going to change is they're going to say left-handed or right-handed dentist on the test is your operator zone and your assistant zone.
Yep. Don't look good. I think that was it.
Don't pay attention to this chart because it's
Yeah,
wrong.
I don't like that. All right. And what else you got? Extra one?
For this one, I think we're going to be done on this one. Hold on. Just know your fulcrum is involving your pinky. Fulcrum, pinky.
I think that's that one.
Aspiration is done with a high volume evacuator or saliva ejector. Okay, it's removing plus blood and saliva. So I talked about before with your high volume suction using an aspiration. And you have two grips. You have your reverse palm and your modified pen. I've seen that one on there before, right? Modified pen is like you're holding a pen, holding it right there, and the reverse palm. If you've seen somebody like going like backwards like this to suction stuff up. All based off of ergonomics. For dental, ergonomics is key because of the way you're sitting in that chair for those hour-long procedures, not hunched over. And then mercury, just because it mentions it, even though it's not else on your bibs, your mercury control instructions, your VMed instruction 6260.30, right? Again, because it's an environmental type thing, that's why it's your 6200 series, right? And think of 60 as 6 in dental, so 6260 is going to be your amalgam disposal, okay? Or mercury control. All right, next PowerPoint, and then we're done. So 24, and this is the most important one. We should have done it first.
If we move too quick, let me know, but I'm gonna try to run through it.
There's only 8 slides on this one, only 8.
Yeah.
And if you don't mind, Chief, I want to help out on the dental radiography when you hit there and do a same demonstration.
Never done before.
All right. So we don't worry about that. That's just the normal stuff we do, just like you seeing a sick call patient.
All right, we went over those. This is
So
the-
diseases. Oh, what did we just pass? We missed one.
More diseases?
Yeah. So we talked about what the diseases were and how to identify them.
Oh, yeah,
We need
the
to know the treatments here, right? This is why I said this chapter is important. They're going to throw scenarios and ask you how you're treating each of these dental diseases. Okay. So for your dental caries, know this thing right here in parentheses. Your zinc oxide eugenol is your temporary filling that you will be using to fill the cavity on a dental carie, and then you're going to return to the DTF the next day, right? Temp filling of zinc oxide eugenol for dental caries. Okay. Acute pulpitis, right? So it's involving an inflammation within the pulp. Okay, so you're going to dry it with cotton pellets, and then you're going to pack that tooth with cotton pellets. What you're doing is basically you're cleaning out that canal to remove any infection or bacteria, and then you're packing it with cotton pellets until they can get seen the next day. And then those pellets are going to be moistened with eugenol, all right?
That's what it says.
Moistened with eugenol and return the DTF next day. So once it's cleaned out, they're going to put some good aperture points in there to fill out the space, and they're going to put another filling over to protect the tooth. Okay, now periapical abscess, right? We learned about this. Peri means what? around. AP means what? Apex, or the top of the apex, and then abscess, right? So for that's the one that where the person feels like they're biting high, right? As the tooth feels high. Okay? Again, it's going to look like a grape on the radiograph. They're going to drain the abscess by puncturing it, and then rinse with salt water. So there's a couple times you're rinsing on these dental conditions. So no, for this one, you're rinsing with salt water 10 minutes every 2 hours. 2 hours is another common number that's keep popping up here. So salt water for 2 hours after draining the abscess, which again, related to medical, most of all are medical. Same thing that you would do for your regular abscesses is draining it.
What you gotta look at?
Marginal gingivitis.
Yeah. I don't think
Warm saline?
Yeah, the warm saline for it.
Okay, so we had salt water with the periapical. We have warm saline for your marginal gingivitis, which is what's the important thing about marginal gingivitis? Most common periodontal disease. Which one was the most prevalent disease to mankind? Periodontal disease. Okay. Temp over 101. What you need to be knowing about no, right? Why are we worried about a temp over 101? Infection, right? Same treatment as marginal gingivitis. So if it's the same treatment as marginal gingivitis, what am I rinsing with? Warm saline. Okay. Warm saline. Periodontitis. Hold on. We're on the next one here. Again, that was another abscess. We're draining with draining it and then doing warm saline. And then we have pecornitis or pecorn, right? Again, here's that 2 hour mark. Patient rinses every 2 hours. You're getting the flap, right? Because we're worrying about flap with periodontal disease, right? That's where it's talking about that open flap will be in there in that situation. And then, of course, antibiotics. Stomatitis, okay? So this is the inflammation of the oral mucosa, right? We talked about herpes simplex 1, herpes simplex 2. Stomatitis, what's another word for that? Canker sore, right? So what do we tell somebody who has a canker sore? No smoking, no hot or acidic foods, no alcohol, no more lying, right? That's what your parents always told you. Okay, this one right here is a big one on the test. Your post-extraction hemorrhage, right? What does hemorrhage mean? Okay, so this is after you have a wisdom tooth extraction or any kind of oral surgery, right? Heavy bleeding from the extraction site, okay? So how do we stop heavy bleeding? Direct pressure with a gauze, right? Well, guess what? You're packing that site with a bajillion moistened sterile gauze to stop that bleed. And why is it moistened? What do we not want to cause? Well, I know you've heard this term. Dry socket.
It's gonna hurt like hell.
So another way to know dry socket is caused from extractions.
Can I get this one?
Yes. Just make sure you hit on these names right down here.
Yeah. So real quick, I'm gonna hit these real quick for the fractures. Same thing. Don't get it mixed up with the classes and then the types and all that other stuff. So for this one, these are the fractured tooth, right? The fractured teeth. So you got a type 1. So it's just like a little chip. It hits the enamel. It's an enamel fracture. Type 1, enamel fracture. Type 2, right? So right here, it's an enamel indentin fracture. The reason why you can tell, because you can see like that little triangle piece, that's the pulp. So it hit the enamel already, and it's also hitting the dentin. Now, type 3, it's enamel dentin fracture with pulp exposure. Pulp exposure. So right here, if you got any type of blood going inside that blood vessel inside that tooth, is bleeding. Make sense? This thing is open. You can see the inside of this tooth. Pulp exposure. Make sense? All right, type 4, the root fracture. So you already hit it, and you got a root fracture going on. This is some type of like actual like damage. So your teeth is still in there, but it's like it's fractured on the inside.
Don't miss this at the top here, right? So I talked about dry socket, right? Your other name for dry socket is post-extraction alveolar osteitis, right?
That's gonna be on the test.
Okay. You are packing it with moistened iodoform gauze strips. Know that. Moistened iodoformed gauze strips.
Yeah.
That has been on the test.
I think that was it with that one.
Yep.
Fracture.
Now this next one is right here. Please know this. Okay, this is a splint right here. So this is talking about those types of fractures that we mentioned, right? So type 1 was which kind of fracture? Enamel. Right? So we're going to smooth the edges with sandpaper strips, dry with cotton rolls, apply a varnish, and then avoid extreme hot or cold because it's just an enamel fracture, right? Your type 2, you're going to isolate the area with cotton rolls, dry the tooth again, use that zinc oxide that keeps popping up, zinc oxide eugenol paste. You're going to tell them to get a bland diet, and then here, the difference here is you're filling the crown with the calcium hydroxide or zinc, right? So this is the only time you've seen calcium hydroxide is for type 2 fractures. Type 3, right? So this one's involving what? Everything down to the pulp.
Right, there
So
we go.
I need to use a splint, right? Using, what's that material they use? Isn't it zinc eugenol paste still?
Right here,
Yeah, so they have a zinc eugenol paste that they're basically putting on. If the splint, right? How do we apply a splint? Above and below. So on teeth, it's going to be on the left and the right of it to make sure they're stabilizing that splint, covering the affected tooth, which is probably this bad boy right here. All right. So now, so they're going to use that splint, and then it's treated by a dental officer. A lot of times you see that with Marines that want to go punch each other in the face.
Yes.
Or jump out of a Humvee and have the butt of their gun smack them up in the face.
Yeah. So these are the type of damages and stuff like that that you'll see.
What is this bandage called?
What type of bandage is that?
Come on, FMF guys.
Cravat.
Nope.
That's what the thing is. But what type of bandages is like? What type of wrap?
For jaw fracture.
Huh?
For a jaw fracture.
Yeah, it is for a jaw fracture, but what's the name of it?
What is it?
It's a
This is
Barton
the test.
bandage.
Barton bandage. Barton bandage. That's on the test. They're gonna show this picture just like this. What is this? Barton bandage.
Dramatically extract the teeth. You get in a bar fight. All right, you're gonna rinse that tooth with saline and place back in socket. So you do have a short time frame where you could save the tooth, right? Okay, and I believe that's it. Sorry for going over time.
Fine.
I'm about to go.